Hi everyone, good morning, good afternoon, and good evening. Welcome to Excela Health Virtual Mall Walkers. Today is Thursday, April 23rd, Mall Walkers Day. And while we're not able to meet with you in person, we're really excited to be able to bring this program to you right at home. We have a special treat for you. Today we have Dr. Robert DeVoli, who is one of our Excela Health primary care physicians, and he has recorded a special video presentation just for you. He's going to be talking about hypertension and stroke and what we need to know about both. Let's welcome Dr. Robert DeVoli.
Hello, my name is Robert DeVoli, MD. I'm a primary care physician working out of the Excela Health, Derry, and Blairsville offices. I've been on staff at the Excela Health Latrobe Hospital for the last 35 years. May is Stroke Awareness Month. I've been asked to speak to you briefly about stroke and its causative agent, hypertension. But before going any further, I think there is some perspective that needs to be made. It is estimated that 1 in 3 Americans have hypertension. That is roughly 100 million Americans. We also realize that the CDC each and every year recognizes stroke as the 5th leading cause of death. Its cousin, heart disease, sometimes referred to as a heart attack, is still the #1 killer. So as you can see, stroke, hypertension, and heart disease are a big problem in the United States. I think it's important that we review what is considered an ideal blood pressure. For the longest time, the reading 120/80 has been the gold standard. Over the years, the acceptable readings above 120/80 have steadily decreased. Whereas at one time 140/90 was acceptable, that is now what I actually start treating people with medication. Numbers in between 120/80 and 140 are modified or treated by lifestyle modification, such as weight loss, salt reduction, alcohol reduction, and exercise. I believe at this time it would be important to also discuss some of the signs and symptoms of stroke. The acronym BFAST is an easy way to remember those signs and symptoms. The first letter, B, refers to balance. Sometimes people present with balance difficulty when an involving stroke occurs. E, that refers to eye. That means visual disturbance, sometimes out and out blindness in one or either eye. F, face. This refers to facial weakness felt by the patient or facial droop seen by another person while the person is having a stroke. A refers to arm weakness. Again, arm weakness in conjunction with facial weakness could very well indicate a stroke. S, this refers to speech, be it slurred speech or simply the inability to speak at all, even though the brain knows what it wants to say. T, this refers to time. Time is of the essence when a stroke is in evolution. If you have any of the above signs and symptoms, I think it's very important that you call 911 and present yourself to one of the Excela hospital emergency rooms, which, by the way, are credited for stroke treatment. There are just several other symptoms that I think one should be aware with in this relationship to stroke. Those being basically generalized confusion, inability to understand commands or the written word. And lastly, a headache. Headache oftentimes is one of the signs and symptoms that an impending stroke has occurred. I would like to conclude by stating a one recommendation. Know your numbers. Please know what your blood pressure is. It is not known as the silent killer for nothing. While you're at it, I think it's important to know what your blood sugar is and what your cholesterol is. This means visiting your physician at a minimum of once a year after the age of 40. If you're being treated for any of the above mentioned illnesses, namely diabetes, hypertension, and cholesterol, I think it's important that you see your doctor almost on a quarterly basis. Take your medications. This may be the difference between having a stroke or not. Thank you.
Welcome back, Mall Walkers. We hope you enjoyed Dr. DeVoli's presentation on hypertension and stroke. We've included some resources in your email that go along with this presentation, so be sure to check those out. Up next, we have our favorite home chef, Ms. Dawn DeVoli, with another segment of What's in Your Pantry.
Hey, welcome back to another episode of What's in Your Pantry. Tonight, I'm going to be making a dinner entree, and it is called Pantry Pasta. So for this recipe, when I was looking it over, I thought, wow, this looks really good and really tasty. I think this is something I'm really going to like to make. As with other recipes, I sometimes didn't have the ingredients, but guess what? Tonight I have all the ingredients. So I'm going to take you through. I'm going to show you how easy it is to make. And you really should smell these onions here sauteing. They smell so great. I will also show you some substitutions. We'll talk a little bit about the nutrition information and give you a heads up on what's going to be coming up next week. So with the pantry pasta, you start with sauteing your red onion in olive oil. So that's cooking real nicely. To that, we're going to add a can of diced tomatoes. We're going to add chicken stock, assorted olives. I have black and Spanish olives. Chop them up. Okay. And then we're going to add a jar of artichoke hearts. Now this might be something that you don't have in your pantry all the time, artichoke hearts. I try to cook the Mediterranean way, follow the Mediterranean diet, so I typically use and have artichoke hearts in my pantry. So we're going to mix that up. We're going to add some minced garlic. And this is going to simmer. So this is our sauce, okay? The tomatoes and the artichoke hearts. Now, what I wanted to go over with you is if you don't have these particular type of ingredients, you know, there's always a substitution. We could use crushed tomatoes. You could chop up some peppers and saute those with some mushrooms and some zucchini. And then I would probably add some Italian seasonings to that. So this is simmering very nicely here. And to this, I've already cooked my pasta, and you can use whatever pasta you have in your pantry. I happen to have farfalla. Some people call it bow tie pasta. This is actually one of my favorite shapes. And I think this is going to look really pretty in our dish. So we're going to stir that up. Has a lot of really nice color. Okay, so once this is all mixed together and heated through, we are going to add prepared pesto. Now, if you have pesto that you make from your garden that you froze, you can always put that in this dish. If you don't have that and you don't want to make fresh pasta, this is a great substitute. This pesto that comes in a jar right from the grocery store. So again, I happen to have this because we eat a lot of pesto with pasta. Okay, so that's giving it a super nice green color. And I'm going to add some salt and pepper. You know, you can always forego the salt if you're trying to watch your sodium. I just put a little bit in. And I do like a fair amount of pepper. So we're gonna add that. Stir it up some more. Next goes the feta cheese. We're gonna stir that in. So if you wanted to make this dish a little bit lower in sodium, the two original ingredients that are the highest in sodium are the artichoke hearts and the feta cheese. So you could either cut back on the amount of those that you use, or you could substitute it with something else. So wow, this looks super good. I'm gonna plate this up. This is actually gonna be my dinner tonight. I can't wait, it smells so good. And then we're gonna top it with some pine nuts. Give it a little bit of protein, some nice crunch. And there you have it. Can you see that? How good it looks. I can't wait to eat this. This is a meal in a bowl. It has about 1,000 calories, which, you know, all things considering, it is your starch, it is your vegetables, there's a little bit of protein in there, all for about 1,000 calories. So that's not too bad. So that is our dinner. I really hope that you make this when you get this recipe from Laura. It smells so good. I can't wait to eat it. And I hope that you will join me next week when we have a special treat. It's going to be a healthy dessert. So until then, stay healthy and stay safe.
Mall Walkers, thank you so much for joining us for today's program. We hope you enjoyed it. Be sure to check your email inboxes for some additional resources that we've sent to you. As I mentioned before, we have some resources that go along with Dr. DeVoli's presentation, plus a DASH diet flyer that goes along with healthy nutrition, your 3 recipes, your exercise challenge, and 2 articles. One that talks about ways to preserve your food during the pandemic, and one that talks about ways to support your immune system during this time. We've also included our Decompress Your Stress segment, which is a video that was filmed by our Excela Health Wellbeing Center. So make sure you check it out, take some time to unwind, unplug, and recharge. Thank you again so much for watching our video today. We hope you enjoyed it. Stay safe, stay healthy, and stay home. We'll see you next week.